Welcome back to the Rena Malik MD podcast, your source for evidence-based information about your sexual health and more. I'm your host, Dr. Rena Malik, urologist and pelvic surgeon, and today we are going to be doing our Ask Me Anything segment. This is a segment where we get questions from you guys, our members, and we answer them once a month. And we share the first half of this podcast on the platform. If you want to get the full length, make sure to sign up for the membership at renamalik.supercast.com. There we give you an opportunity to ask questions, to get early access to all our podcasts, as well as transcripts for those podcasts. Without further ado, let's get right into it.
All right, first question. What's a good way to ask my partner on the type of sex we have? I want to be very physical and a bit forceful. My girlfriend doesn't seem comfy with this because she will ask me to stop thrusting sometimes during sex. She's not saying she's in pain, but I assume she's not liking something I'm doing. I don't know a good way of talking about this, as this has never happened to me before. So what do you think?
First of all, everyone has their own preferences in terms of what feels good during sex. Now, she might not verbally say that something hurts or she doesn't like it, but she's clearly telling you there's something that she's not enjoying because she's asking you to stop. So the most important thing here, when you want to talk about what you're interested in within sex with your partner, is to just start by saying, what are you into? What do you like? Not in the bedroom, not sort of during sex or right before or right after, but sort of in advance. Be like, hey, what turns you on? Or what do you really like? If you are in a relationship with someone, it can be as simple as, what do you like that I do? Or what do I do that really turns you on? Or what makes you really excited? And what are your fantasies? Sort of delve into what they're into. And you can even ask them, or if you feel comfortable, ask to watch them masturbate. Sometimes you can figure out what sort of techniques they like, where they like to be stimulated, what really gets them going. Most important in terms of turning your partner on is making sure that they have enough foreplay. So it might be, in this case, particularly that your partner is not uncomfortable, but maybe she needs more foreplay for there to be enough lubricant and enough arousal and time for the vagina to widen and lengthen, which is what happens during foreplay and arousal, so that thrusting deeper or harder is not uncomfortable for her. So it's important to, one, make sure they're aroused, and two, that they are adequately lubricated. Now, we always think wetter, better, right? But that's not always the case. If you are sometimes not as wet as other times, it doesn't mean that your partner is not aroused. It may mean that they're having hormonal changes. Maybe they're a certain time of their cycle. Maybe they're on medications that affect lubrication, like hormonal birth control. There's a whole variety of things. Or maybe they're lactating, like they've just had a baby and they're lactating, which makes their estrogen low, or they're perimenopausal. Regardless, there's so many different things that can affect lubrication. So don't take it personally. Just add lube. Lube is so much fun. It makes things more slippery, more fun, more enjoyable. So try that. And then, figure out, where can you meet in the middle? If you like very physical sex and maybe your partner likes more gentle sex, it may be a discussion about how can you sort of explore each other's interests in a way that you both find comfortable. How can you sort of initiate that? And what are words that maybe you can use to say, hey, I don't want that anymore, and without feeling discouraged. And so ultimately, I think, being vulnerable is hard. Having conversations is hard, but it's super important because you can't have good sex if you can't communicate with your partner, because you don't know what they like and they don't know what you like. And ultimately, all we want at the end of the day is to please our partners and to feel pleasure and have a good time.
So direct is best, right? Like you won't get the answers if you don't ask, right?
Right. I mean, we can't read minds. Think about anything else in your life, right? If I want my partner to do something and I don't tell them, and then I get mad at them for not doing that thing, that's on me, right? That's not on my partner. They can't read my mind. I'm sure anyone listening or watching can understand a time where they probably got upset at their partner, or their partner got upset at them because they didn't do something, but the other partner had no idea that that's what they wanted, right? And so the same goes for sex. We have to communicate our needs, our wants, our desires, and we have to be open to it and realizing that it's not a one-time conversation. You might decide 5 years from now that you want to try something else, or you want to do something new, and that's totally normal, right? We don't eat the same foods every day, and we're open to trying different cuisines, and the same thing happens with sex. So it's important to realize that sex is an evolving part of your relationship. It's something you need to talk about regularly and invest in and prioritize, because that's what's going to make your intimate life so much more rich and enjoyable.
All right, next question. Do you know of an effective method for men to achieve non-ejaculatory orgasms so that we can enjoy multiple male orgasms. So maybe we should probably define what non-ejaculatory orgasms are. And can you have multiple male orgasms?
Yes. So let's start off with the basics, right? Men can have both ejaculation and orgasm, and most often they occur together, but they are two separate processes. An orgasm is a brain event. So when you have an orgasm, it's a culmination of pleasure and release that occurs that feels sort of euphoric and pleasurable. It's actually a very mindful moment. You can't really think about anything else when you're orgasming. So that's a brain event. Ejaculation is a spinal cord event. So what that means is that it's a reflex. When you get to a certain level of arousal, your penis sends signals to your spine that then allows ejaculation to commence. And after a certain point, when you reach the first part of ejaculation, your body can't go backwards. It has to emit the ejaculate. So it's somewhat of a reflex. There is a belief that once you ejaculate, that is why you have a post-ejaculatory refractory period, meaning that after you ejaculate, there's a certain time at which you can't have sex again, you can't get aroused again, and you can't get an erection again. Let me explain this first. So when you have sex, there is a ejaculatory refractory period. Now what happens is there is an absolute period and a relative period. And this changes over a lifetime. For certain periods of time, you may have a really short period. So when you're younger, oftentimes you can have multiple rounds of intercourse because that period is significantly shorter. During the absolute period, that could be just a couple minutes and then you could go again. And as you age, that can increase in time to hours and even a full day for some people. There's also this relative period during which time, if you wanted to get aroused again, it would need to be a significantly stronger stimulus, meaning that it would need to be more exciting, more novel, just more intense for you to get an erection. And so you can still, during that period, obtain an erection, get aroused for sex, but it will be harder. Theory is that if you can just orgasm without ejaculation, you might avoid that whole period together. Now, I don't think this is very clearly understood in the scientific literature, but there's certainly people who will say that if you can train yourself to orgasm without ejaculation, that you just feel so much better. Now, I don't know that that's necessarily true. I think that there can be really high levels of pleasure, which can feel like an orgasm, and they don't really reach that full peak. And that's sort of what we're seeing in men who don't ejaculate an orgasm at the same time, is that they're reaching this really high period of pleasure, but it's not reaching the peak where you would ejaculate. And so I think that's what you're training yourself. These guys are training themselves to do, is they're getting to a point of pleasure, but they're understanding where that peak is, where ejaculation happens, and they're kind of dampening down their pleasure a little bit, using things to sort of maintain that parasympathetic nervous system. So they're kind of keeping things from having a strong ejaculation. So they're trying to do deep breathing and relaxing and not allowing themselves to get to that point. And so you can experiment with that and see if it provides you with more pleasure or longer lasting sex. But ultimately, I think we should be, again, focused on pleasure and enjoying your partner and not be really focused on the specifics, because there's a subset of people who will try to abstain so hard from ejaculation that they'll actually develop pelvic floor dysfunction. They'll sort of white knuckle it. They'll tense up their pelvic floor really hard to try to prevent ejaculation. And that over time can create problems. So ultimately, I think the most important thing is to just focus on enjoying pleasure and doing things to really experience and enjoy that fully, rather than being really focused on the ability to then have an erection again, because you can still have pleasure even afterwards, right? You can still enjoy your partner. You can still be intimate and do other things.
Kind of reminds me of another question that I recall in the comments about multiple orgasms. We talked about it for the male now, but women have asked as well. So is there a way to improve that gap between orgasms, that refractory time?
Yeah, so there's no really good evidence on things that can reduce that gap. Unfortunately, they've tried different things to like reduce prolactin, which is what they thought initially was the only factor associated with this time, but those haven't been really productive. So I would say ultimately the most kind of probably beneficial thing is just working on doing the sort of relaxation techniques, sort of deep breathing, enjoying pleasure, not allowing yourself to get so built up will allow you to sort of relax and get back into pleasure. And then if you are trying to go again with that partner, realizing that you're going to need a little bit more stimuli, something more exciting, more fun to really get you there.
Sounds good. All right, next question. It's one of our members. Basically, he has a buried penis. Hasn't seen it in 10 years. He knows he has to lose weight. Even if he does lose the weight, he's wondering if he will have a functional penis after the weight loss.
So let's explain what a buried penis is. So a buried penis, it can be something that you have from birth, meaning it's always been sort of hidden behind fat or skin or trapped. And so there's a couple different ways to think about it. Very often we'll see it in guys who are very big, that their penis then becomes hidden under a fold of fat. There's also guys who get trapped penis. So what that is their foreskin will get stuck because of either skin changes or scarring. And so they can't pull their foreskin back. And that then becomes trapped behind that, or they've had some sort of surgery. The reason that we're talking about weight loss is oftentimes weight loss can help if it's really trapped behind a lot of fat. However, the mons, or the area right above the penis, it's sort of hard to lose weight specifically in that area. And sometimes people will require surgery. Ultimately, there's no exact number. I can't tell you for one person how much weight you need to lose, but certainly I would look at what your weight is and what you need to do to get to a normal body mass index, which you can Google and look up. And that would be the aim I would look for, is to say, like, how can I get to this normal body mass index? And of course, realizing that's going to take time and effort, and it's not going to happen right away. But that is certainly an important part of it. Now, asking about if your penis will be functional, the issue is oftentimes because it's buried, you can't have sexual intercourse easily. And so sometimes it's unclear if things are working. Now, if you are able to sense that your penis is getting hard and you know that there is an erection there, sometimes people can tell that. But ultimately, there's really no great way to tell until you're actually able to have sex, because the definition of a functioning erection is one that's sufficient for penetrative intercourse. What I tell people is the first important thing is to fix the buried penis, and then we'll figure out if we need to do things for the erections afterwards. It really ultimately depends on a lot of different factors. Oftentimes, people who have a buried penis are metabolically unhealthy. So they have high cholesterol, they have diabetes, they have high blood pressure, and those things can then affect blood flow to the penis. They may also have low testosterone. They may also be on medications that affect erections. So a lot of different factors that go into it. But ultimately, if you are struggling with buried penis, you're not alone. It is a condition that we see as urologists, and oftentimes people will need surgery. Obviously, you need to lose weight, but even if they're doing everything they can to lose weight, sometimes it still remains a problem. And in those cases, you'll actually need surgery to remove some of that excess skin so that you can actually then see your penis. Sometimes it becomes even just an issue with urination. So you need to actually do surgery so you can urinate well and not like leak urine all over your scrotum. So there's a lot of factors, but ultimately it can be treated surgically, and you can have a significant improvement in your quality of life if you have surgery for a buried penis.
All right. Can I do my own prostate exam? I know women can sometimes do their own breast exam, so I was curious if I can check my own prostate. What exactly should I be looking for, and what age should I be checking it?
Yes. So a prostate exam is a finger in the rectum. It requires a digital examination to feel the prostate. Now, typically, it would be very difficult, sort of ergonomically, to examine your own prostate.
Yeah, that sounds uncomfortable.
Yeah. So I think it's probably not something I'd recommend you do to yourself. Generally speaking, do you need to do a prostate exam is the question I think really that we should be talking about. And so why do we do prostate exam? Probably, I don't know exactly when the guidelines changed, but when I was in training, everyone got a prostate exam to rule out prostate cancer. And that was because you would feel the prostate, you want to feel for any nodules or abnormalities that would be consistent with prostate cancer. Now, over the years, what they found out is that Generally, people stop doing a lot of prostate exams after the advent of PSA, which is a blood test that we use to screen for prostate cancer. It will detect the large majority, 97% of prostate cancers with an elevated PSA. So what they found is that people who weren't really training on doing prostate exams, like regular primary care or family medicine doctors, weren't doing as many prostate exams. So they were getting a lot of false positives because they didn't know what normal felt like necessarily. And so they would often be like, oh, this feels a little weird. Let me send them to the urologist. And so ultimately, it is no longer generally needed to do a prostate exam because we can detect the large majority of cancers with a PSA screening blood test. However, as a urologist, I find a lot of value in doing a prostate exam, but I do them all the time. So I can tell you when your prostate is enlarged. I can tell you if I feel something that is truly a discrete nodule or maybe just a firmness. I can also, during that examination, check your pelvic floor muscles to see if they are tense or tender, or if there's some dysfunction there. And so ultimately, there's a lot of information that I, as a urologist, can gain from a prostate exam. But for you, doing it to yourself, or even having someone untrained do it, one, it can be uncomfortable, and two, it may not even be very helpful because you don't know what you're feeling. So ultimately, I would suggest that you should get evaluated with at least a screening blood test for prostate cancer after the age of 55, and then either yearly or every 2 years is what's recommended by the guidelines. But again, take your own family history into consideration. If your family history has an issue with prostate cancer, your dad or your brother, your grandfather has had prostate cancer, go sooner to see the urologist or talk to your primary care doctor about it to determine when would be a good time to start screening. And then for other things, in terms of prostate health, I think more important is just to make sure that you're urinating well, you're having a good stream, you're not rushing to the bathroom a lot, you're not straining to pee, or your stream's not stopping and starting, you're not waking up a lot at night to pee, or even having a little dribble after you pee is very common, but it can be a sign of an enlarging prostate. Now, usually this, some people will have some symptoms but not be truly bothered. That doesn't mean you have to do something about it, but just so you know, there are options that we can offer you to help improve your urinary symptoms, whether it's lifestyle changes. I've talked about them on the podcast before with ways to prevent BPH and on my YouTube channel, and what to do for BPH, and then also medical treatments as well, and even surgical options. So ultimately, I think the take home here is talk to your doctor if you have urinary symptoms, get screened for prostate cancer, discuss the risks and benefits of screening with your individual doctor. And if you see a urologist, I think a prostate exam can be beneficial, but it is not mandatory if you don't feel comfortable.
I mean, it makes sense. I mean, if I wouldn't really trust myself if I haven't had many prostates that I've actually examined, nor I guess would I trust someone who doesn't examine prostates all the time. So it makes sense. You probably examined thousands of them.
Yeah. And to be honest, I think you might hurt yourself if you do it yourself, right? Because the tissue in the rectum is really friable. And so we don't want you to hurt yourself. So, we use a good amount of lubricant. We know how to do it safely. There is a little bit of a technique there. Thank you guys so much for joining us for this episode of the Ask Me Anything podcast. If you guys like this and want to check out the rest of the episode, make sure to sign up for our membership at supercast.renamalik.com, where you get access to new podcasts early each and every week, as well as transcripts, the ability to ask me anything, and to be part of our community. And as always, I'm going to take care of yourself because you're worth it.